Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Hi everyone, this is Meghna Bhatt from Prevent Connect at Calcasa. I'm so excited to talk to Hamida Yousafzai, the program manager at Bantay, Srei. And today we will be discussing the role of community health centers and culturally specific or culturally relevant services in addressing and preventing human trafficking in our communities. So how are you doing, Hamida?
Hi, Meghna. Nice to see you. I'm very well, thank you.
Great. So could you tell us briefly about your organization, Bantay Srei, and how it originated?
Yeah, sure. So Bantay Srei is Khmer words for Women's Citadel or the Church of Women. It's a non-judgmental youth development asset building organization that works with anybody, but with a focus on young Southeast Asian girls who are at risk or engaged in the underground sex trade. So in 2004, in response to a rising number of sexually exploited Southeast Asian youth in the local area of Oakland, California, Asian Health Services, who is the umbrella organization, Bantay Srei is part of the advocacy wing of Asian Health Services. Them, alongside other community organizers, co-founded Bantay Srei and Teen Clinic. And the providers developed a CSEC, Commercial Sexual Exploitation of Children protocol, which was a screening tool for clinicians. They then went, AHS, Asian Health Services, went on to write an important paper that was published describing some of the risk factors for CSEC and how important a CSEC screening protocol is for the medical field in identifying victims and being able to refer them for help.
Okay, I mean, that's fascinating. What started out as like these grassroots efforts and how Bantay Srei reinforce and, create these protective factors while identifying the risk factors, especially for, keeping in mind being a youth serving kind of movement and an organization for Southeast Asian women, right? So I think it's very interesting to see that. And you mentioned the Asian Health Services. So how do you see like the role of community health centers, such as the work you do in preventing trafficking?
So I see the work as crucial. I think that community health centers are wonderful places. I think they are population oriented. They're located within the community, and they are the community. And people always return. So the clinic is in a unique position and must be prevention focused, thus addressing all forms of violence and exploitation, including human and sex trafficking. At all levels, at the primary, the secondary, and the tertiary level, there's an opportunity to screen patients, ask questions, and probe. I'm aware of the socio-ecological model, SEM, which is a great example. This framework embraces the complex interplay among factors that contribute to public health problems, and it's a holistic approach. So, looking at the individual, relationships, community, and societal factors. Asian Health Services is very keen on health education, so a health sector-based awareness education, imperative for survivors and victims of human trafficking, an education that really encompasses environmental health, physical health, social health, emotional health, intellectual and spiritual health. And this can help reduce vulnerabilities and enhance capacity. At Asian Health Services, we serve everybody: uninsured, underinsured, refugees, immigrants. And it's this comprehensive primary care really that includes outreach and prevention. So we offer trainings to schools, policymakers, business owners, corporate representatives, other healthcare practitioners, and the really crucial component, our board of directors. It has over 50% representation of patients or service users. Trafficking has emerged as as one of the issues of the patients, so we're responding to their needs.
Thank you. Yeah, it is so important that I think you have this multi-sector and interdisciplinary perspective, also keeping in mind the bigger public health model and the spectrum of violence prevention. And I
Right.
think that is so important to incorporate these components when you're trying to address and prevent these wide range of forms of gender violence, especially focused with on trafficking.
Right.
And I think the work that you mentioned, especially with the role of community health centers, also focuses on this whole health equity and justice and
Right.
involving key stakeholders and communities that have been marginalized and whose voices have
Right.
not been heard. That's really critical and important to know.
Mhm.
And one of the unique critical elements you mentioned that your program offers is being culturally specific. An example of this, which I read, was the Srei program and the Khmer program. What are the culturally specific components that you bring to preventing trafficking through these programs?
I would say that all practitioners and staff at Bantay understand Southeast Asian intergenerational trauma,
Mm-hmm.
the family structure, cultural taboos and stigma, and how to appropriately engage with parents and family members. This is crucial. Another component is really around language access, um, translation, interpretation services, and especially for parents and family engagement. Um, Education again, and peer support from role models in the community who understand some of the experiences and some of the barriers that challenge very specifically Southeast Asian CSEC youth and women in Oakland. And then support and referrals to be able to access reproductive health, mental health, and other social services and resources. These are all very particular components that provide a culturally specific response to a very particular demographic.
Okay, and yeah, that is interesting because I think one of the things that we kind of had an idea, even through the web conference that we did with your colleague Rumani, was I think even on the focus of arts based and also the intersectional, like in terms of food and culturally specific programs that you offer to youth, right? So
Yeah, absolutely. The healing activities as an umbrella term, so many things will be celebrated, including food, including dance, making things, arts and crafts, like healing activities um, with folks from your own community and being led by a leader from the community. We just really get you. And it really is a safe space, and the space is held very well as well.
thank you. And so, how has been the response from your community with this whole blended approach in terms of, specifically keeping in mind prevention and addressing the dialogue about trafficking in our communities?
The response is overwhelming, really. If I think about since its inception, Bantay has had a steady caseload of survivors and victims. Um, so they know we're here. We've had new referrals even just this week. Unfortunately, we're not reaching enough victims or reaching the most vulnerable because there's so many barriers for CSEC, for Southeast Asian CSEC, young women and girls. There's so many barriers to accessing services. Living with trauma, not being able to see yourself yet as a victim, being scared to report for fear of deportation of themselves or a family member, fear of being criminalized, fear of being killed or seriously injured. If you have another intersection, if you're queer or trans. So day-to-day operations consist of a lot of prevention work, including some of the programs that you mentioned, like Source and Srei. So really focusing on field trips and healing activities involving food and cultural pride and fostering cultural pride We try to integrate our youth's experiences into the programs that we provide and always have a trauma-based approach. I think whenever you work in the sexual violence sector, the response is always overwhelming.
Thank you for explaining that, and I think it's interesting because again, to start any dialogue in a community, especially keeping in mind cultural, barriers or taboos that we address in our communities that we may experience while providing prevention or response, and to address those challenges, what would be like, how would you identify like any of the successes or challenges that your center may have faced, in terms of prevention or creating this dialogue to shift the culture, the way we look at violence and we respond to violence?
Asian Health Services, I think as a whole, it's successful in that, we're getting to shape the dialogue around CSEC and promote best practice, emphasizing or being able to draw a line in the sand to say, yes, the public healthcare system has a unique integral role to play in fighting sex trafficking and human trafficking. It's the responsibility of the healthcare system. Groundwork started in early 2000. And, if you're anti-poverty, you're anti-human trafficking. A challenge would be political will and funding streams. So we need to shift towards true prevention and long-term recovery. And the emphasis must be on the patients.
Okay, thank you. And I think based on what we are discussing and the description you're providing of the different programs, I think kind of focuses on one important component that keeps coming up is in intersectionality and partnerships.
Right.
And I think it's so important to include all of those key pieces, while developing prevention programs, especially keeping in mind, again, the culturally relevant or culturally specific frameworks.
Mm-hmm.
So I know you mentioned partnerships and you mentioned Asian Health Services, but would you like to elaborate a bit on what key partners have helped the programs be successful?
Yeah, I have to mention Asian Health Services again because, we're just one of the programs. And, I'd say when the going gets tough, they're there. And when we need to celebrate, they are there. And the leadership, the staff, the patients, and the community really remind us why and how we exist. Asian Health Services support Bantay and offer us guidance on all levels and offer us best practice. I would also mention the East Bay Asian Youth Centre, IBASI. I would mention the Office of Violence Against Women, OVW. There is the Devata Giving Circle, which is a collaboration of women who support organizations working to advance the human rights of Cambodian women and girls. I would mention Yahoo Employee Foundation, and private philanthropists. Donations will come out the blue from anonymous people, and a lot of folks from the community who give through loyalty and unconditional love, and they're always there, and they get very excited when you tell them there's a fundraiser. So yeah, they're the majority of the key partners that really help advance Bantay Srei and hold us up, and who we can learn from.
Okay, thank you. This has been exciting and such an interesting discussion. And for our audience, you can also get further details about the collaboration that Prevent Connect did between Asian Health Services, Bantay Srei, and in our Prevent Connect web conference recording, which I mentioned earlier, that's the public health approach to preventing human trafficking that happened in March this year. So thank you so much, Hamida, for your time and providing your insights about the role and implications of providing culturally specific and relevant and public health frameworks, in terms of preventing and ending human trafficking in our communities. Thank you so much.
Yeah, thank you. Thank you for the opportunity.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.